So I gotta set something up for 2025, dog. I've been at it too long, man. It's time to hang my stethoscope up, you feel me? I got to, man. I gotta hang it up, dog. What we represent, man?
Big money bound.
So let her know, man.
Big money bound.
We got the kids, man. We got the kids, man. Big Money Bound TV. RRT Posse YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time. But I also release some unscheduled videos throughout the week. Now, if you're returning, hey, welcome back. I appreciate all of the support. Thank you. Let me close this right here. Let me close. I ain't even take this down. My bad. Last night, oh yeah, man. Excuse my hair, like, bro. I ain't waving no more. I know I ain't waving no more. For real, nah, man. I ain't waving no more. I already know it. It's been a minute, dog. I've been just, like, really grinding and getting it. Just running these bands up, you feel me? Shout out to everybody that's blessed. Everybody else who's running it up, man, count your blessings, dog. I ain't worried about how much you're getting and how much you got. Hey, cuz you're getting it, you're blessed. But, last night, man, I was down in the ER. I just came from working 14 days. I had 1 day off. Now I'm back for another 14 piece, dog. I just gotta keep grinding and doing this and doing this. Then, like, come, like, around August, September time, I'm gonna take some time off, you feel me? I'm gonna have to take a little time off. But, I had the ER, man. The day shift, it was super busy. Super busy. I'm talking crazy. Like, when I come down to the ER and I'm starting my night shift, the day shift person will make sure I have, like, backup equipment, like standby vents, standby BiPAPs. So in case something happens while I'm down there, I got a place I can go to and grab a vent just like that, a BiPAP just like that. I get down there, it's no standby equipment. I'm like, hey, man, what all the equipment? What's going on? Oh, it's been busy. It's been real. I got this set up, that set up, set up. Hey, yo, that's cool. But when you go set up a vent, you set up another vent, and you see that your reserve is running low, you got to get that figured out and fixed, man. I grabbed the last vent. It's 6:45. I'm finna leave soon, so whoever come behind me, they got to figure it out for themselves. Which is what I had to do. And I ain't get a therapist such a hard time because, like, for one, that ain't gonna solve nothing, man. Ain't no equipment down here. So me just complaining about it, dog gone, you feel me? And for two, I had to go find equipment. So I'm down there. I get a report from all the people that's ventilated and that's on bypass. I find out what rooms they in. Okay, boom, boom, boom. Appreciate that. Now I gotta go find equipment. Gotta go find some vents and some bypass. As I'm going to find this equipment, I get a phone call from a nurse in the ER. Hey, a patient just came in, fire rescue on a BiPAP. We need you to bring a BiPAP to this room. All right. That's no problem. Right now, I'm in search of a BiPAP because there's no equipment in the ER. So just give me a second, and I'm going to find, as soon as I find a BiPAP, I'll be there. When the patient come in from fire rescue on a BiPAP, they're on the fire rescue disposable, like, it's more like a CPAP machine. So they're getting, like, some type of respiratory support. They have something. They're just not on room air needing a BiPAP. They have something. So why go and find this equipment, which I found, cleaned it down, cleaned it all down, took it down to the ER, hooked the patient up on a BiPAP. That patient good. But now I still have no reserve. I got to go find vents. I'm just finding, bro. Like I say, I don't work like the last couple days. So I know where, like, I had a few patients that was on the floors that had BiPAPs and they weren't using them. So I went to that room, took that out. Knew what vent was, took that vent. So now I'm cleaning and I'm pre-use checking all this equipment. At my hospital, we have a respiratory tech that pre-checks, cleans all the equipment for us. So I haven't pre-checked or cleaned any equipment, bro, since 2016. But luckily, At my per diem job, the therapist still have to clean the vents from time to time. I'm rarely there, so I rarely clean, but I have cleaned, so I remember how to like pre-test, do the lung, do this and do that. Now, had I not been doing that for 5 years, bro, I wouldn't know how to pre-use check no vent. But luckily, I knew what I was doing. I came across three vents. So now I got 3 vents standby. That can go ventilation or BiPAP. So now I got some equipment. I'm good. The next thing I know, my director get a call from ER director saying, why is Randy telling them that we don't have no vents in the hospital? Bro, I ain't say no. Some dog tell me like, hey, bro, you said we ain't got no vents in the hospital? I'm like, dog, I ain't say that to nobody. I don't know what they talking about. I said I don't have any vents in the ER. Let me go find some equipment, which is what I did, and the patient doing good. He like, yeah, man, them folks crazy. Bro, they gotta be. So now I'm down there in the ER. Mind you, years back, I used to work in the ER as a stock tech, stocking everything up. My old job boss, so I'm in the ER. Hey, yeah, Randy, what's going on? You said there's no vents in the hospital? Like, hey, I don't know what y'all. I don't know what you're talking about. I got 3 vents over here. And we got vents everywhere. So we're okay. We're okay. Hey, man, as long as I'm here, you all right. As long as I'm in here, you okay. Bro, I just kept it real. As long as I'm in here, you all right, dog. How did me saying I gotta go find some vents get misconstrued to we don't have no vents in the hospital? And I go from that director to this director because when you say it's no vents in the hospital, that means any like cardiac arrest patients from the outside can't come into the hospital because we don't have no vents, which means we missing money, which is why my director called me, the ER director called me, like, bro, they not trying to miss that fatty, man. Anybody who work in the hospital, you know how it is. You can have a 20-bed ER. When they get to capacity, they're going to find a way to make that 20-bed ER hold 25, then hold 30, then hold 35. Bro, they will have patients lined up in the hallway on stretchers, man. I seen some people put 5 people in one room and go get just little curtains to put in between people, tape curtain, bro. Hey, dog, what is about that fatty? All right. People ain't missing no money, dog. So I'm saying ain't no vents. You saying we ain't finna get no vent charge money? Y'all better figure it out. Feel me? So it was coming from a head top on that one. Then I had a patient that was really had his nurse running me down by treatments. Because I'm covering the ER, but I'm also covering a little small section around the hall that has some patients over there that's admitted to the hospital that's just waiting to go up to the main floors. They got a patient over there has a treatment due. Like I said, I'm in the ER, trying to find equipment, hooking people up to BiPAPs, getting vents. Bro, I'm busy, you feel me? So dog got a treatment, y'all got to bear with me. Hey, he really needs it. He's calling for it. He said he wants it. Hey, bro, I understand that, man. As soon as I get a chance, I'll be there as soon as I can. I got people on vents, on BiPAPs. I'm getting ABGs. I'm getting needle sticks. That's why, as an ER therapist, man, you got to know how to prioritize, and you got to remain calm during stressful situations, dog, because that thing can be stressful. People pulling from here, from there. Man, I don't want to get off topic, but I had a doctor that was telling me, hey, I need a treatment in this room. I need a treatment in this room. I'm like, hey, man, what's the COVID status? Oh, the test is pending. Hey, I can't give nothing until that test comes back, till the results come back. Well, all right, can you come back in 12 minutes? Get a treatment? Hey, Ray, I get a treatment when the patient COVID status is in. All right. I can't, no sooner, no later. Whenever I get in, that's when I get a treatment. So I get done. I go over there and I take care of that breathing treatment for the patient that was over there in this area waiting for the treatment. I get over there to that patient who keep calling for it. Dog sleep. Bro, how y'all gonna say somebody want a treatment? Excuse me. How y'all gonna say somebody want a treatment? I come over here, dog sleeping like a baby. I'm like, hey, nurse, man, you say the patient want a treatment? Dog sleep, man. Oh, no, wake him up. He'll wake up. I'm like, hey, sir. Hey, man, dog sleep, dog. Dog is sleep. He was just asking for it, and now he sleep. So they wake homie up. I give him his treatment. I go back over here. I'm like, all right, doc. Since you got your computer in front of you, hey, what's the COVID status? Oh, it's positive. Hey, y'all stay safe out here, dog. Like, bro. It was a night I ain't had ER. My homeboy said a nurse came and asked him, hey, why is Randy scared of COVID? He's scared of COVID? Dog, like this. What you mean? Why is he scared of COVID? There's a lot of people who done got COVID and got over it, for they feel like they got antibodies. I ain't had it and ain't trying to get it. I'm scared. So when you call me to a room for intubation, I'm putting on all my PPE, hair nets, goggles, gowns, face shields, N95, double gloving. Bro, I'm scared. I'm in here with everything on. Person got on a level 1 mask doing intubation. So to them, I seem scared as hell. Hey, bro, I ain't had it. I ain't trying to get it, though. You feel me? So I am scared. Why is Randy scared? But I said, hey, my dog ain't trying to get no COVID. Y'all tripping, man. Speaking of people tripping, dog, like, these folks telling me it's an ABG. The order's coming across on my phone now. ABG is due in room 74A. Okay, cool. I go to 74A. I see the patient. Don't seem like nothing wrong. And I see a paramedic coming to transport the patient to the floor. I'm like, hold on. Let me double check this order before I stick somebody. Let me double check this order. Make sure this is the guy. Bingo. Wrong dude. All right. I hear him calling me. Hey, yeah, I got a treatment. I got an ABG that I need in 74A ASAP, please. All right, no problem. I'm thinking maybe the patient was in like the triage area. They coming back to the room 74. All right. Go back to 74A. No patient is there. Hey, man, I go over to the nurse station, like, to the doctor station. Like, hey, man, I done been to 74A 3 times. Ain't no ABG due over there, man. Oh, it's in 44A, not 74A. The patient in one room, the order coming up to the phones in another room. Even in the computer system, they got the patient in one room, but he in another room. Hey, man, that's why you got to, like, really, like, check your armbands, check your orders, and be careful, because I don't want to stick nobody who don't need to be sticked for something that wasn't even ordered for them, you feel me? And, like, when it comes to, like, stick, I got to stick to, like, my reason while I'm here. I'm in here to one day be able to get out of here. No sooner, no later, you feel me? If I can't leave, I ain't gonna leave. If I can't leave, I'm not gonna stay. I'm doing this, doing that, doing this, doing that, dog. These secretaries calling me. They need a BiPAP in room 60D. Bro, I'm in 60D right now with the BiPAP setting the patient up. Like, y'all gotta chill. Oh, I'm sorry, I didn't know. Of course you don't know because you're not in here. I don't know. It ain't in them I'm mad at, dog. The doc should be calling me, you feel me, who know what's going on with his patient. Not tell the secretary to call the therapist. But you know what, man? It is what it is, dog. Can't make nobody make me hate the job that I'm blessed to have. And I'm getting, like, I'm reaping the benefits from it, you feel me? Speaking of that, I saw a lady today, last night at work, man. The lady was like, a worker in the hallway, man. I'm starting to hate this job. Everybody can hear you. Know me. I'm in the vicinity of where you're screaming at. I'm gonna try to, like, you feel me, put a little game in your ear for you snap and go postal. I ain't trying to get hurt. I'm like, hey, man, like, I understand you having, like, a rough night, you having a bad day. But you can't don't forget that there's somebody out there that, like, killed to be in your position, man. People out here unemployed. Waiting on the government to give them some kind of relief and they getting $600, man. People out here with COVID, bro. People out here that died from COVID, bro. You still here living, you working, bro. You gotta count your blessings, like they said. Oh my gosh, now that you say that, man, you so right, like you. And I ain't trying to give it to you to get like, oh man, I'm just trying to like give you the real, like put what's in front of you, like bro, like you have a job, you employed during the pandemic, dog. During the pandemic, you're employed. Yeah, you having a bad day, but that's what comes with the territory. It's somebody who will literally, bro, come and knock you out to get your job position, bro. So you better count your blessings. Be careful, though. No, you right. Yeah, you right. Hey, I'm just saying, hey, just be thankful, though. I know you trying to say I'm right, but hey, be thankful, baby. On that note, I'm thankful I got a car, man. And I'm thankful it's a Mercedes Benz. You feel me? Hard work pays off. So I'm finna get up out of here, man. Thug, I appreciate all the support, man. Thanks for rocking, man. Like, I just had a hard night, you feel me? But I still found the time, the strength, and the energy to like get in front of the camera and give y'all this content. Because I appreciate the supporters and I love the supporters, you feel me? If it wasn't for the supporters, I would have been stopped. If it wasn't for Jody in her entirety, I would have been popped. I would have been like, bro, I'd have been went crazy, dog. Snapping on whoever, whatever, you feel me? On that, I got some people that's dependent on me, you feel me? I done got them accustomed to a certain way of living, and now to just take that rug from up under them, just pull the rug from up under their feet, just pull the rug from up under their feet. I'd be wrong, so I gotta think differently now, you feel me? Thank y'all for rocking with me, dog. I gotta let my car warm up, man.